According to the Connecticut Health Association, each year in the United States, nearly 3 million children are hospitalized. When I asked my audience if they knew what a child life specialist was, they didn't have any responses. So I would like to take this time to let them know what a child life specialist is. Having researched the occupation myself, I can give information on their education background, how they provide effective coping, provide emotional support, encourage a child's development, and provide information. First, let's take a look at how one becomes a child life specialist. Child life specialists require education beyond high school. Some child life specialist positions only require a 2-year degree, however, most prefer a bachelor's degree. A child life specialist studies child development, child and family studies, psychology, and early childhood education. After their graduation, they are required to do 480 clinical hours of practice before they can apply to take a final test, which, if they pass, allows them to become a certified child life specialist. Now that we know what a child life specialist studies, we can look at how they use the skills they learn to promote effective coping. Coping is a big issue when a child is in the hospital. Lots of times, the child life specialist needs to figure out what are stress factors that are causing the child to be stressed, the family to be stressed, or anybody else. Next, they need to figure out how to describe coping behaviors, styles, or techniques to the family or whoever is stressed so that they can relieve that to help focus on making the child better. Next, for effective coping, they really try to keep the effective pain management down. When a child is in the hospital, they often are there because they have some sort of pain. One of the biggest things in medicine is to make sure that pain is taken care of above anything else. Next, the child life specialist needs to provide an opportunity to play. While being in a hospital, this may be very difficult. So, the child life specialist thinks of things that they can do in the hospital to help the child play. These could be things such as toys, lots of teddy bears, paper airplanes, Nerf guns, anything like that can be used. Another effective coping mechanism is music. Whether it be choir, just singing fairy tale songs, playing a musical instrument, teaching them to play a guitar, the piano, they just really like to teach them to use music as a way to cope. Another thing is board games. Board games helps take the child's mind off of what is going on and lets them focus on just playing and being a kid. Another thing they like to use are books. Books are a great tool to teach the kid while maintaining their, while they're going through a procedure. It helps distract them. Another thing is art. They can express their feelings, what their emotions are at the time, just anything to get their mind off of it. Last but not least, they like to use sports. If the child was involved in a sport, they oftentimes will try to keep that sport going while in the hospital. And that does sound difficult. However, they can still talk about the sports, they can play it, maybe a little bit inside the hospital, just tossing a ball back and forth or anything like that. Just something to keep the child playing. Next, after they provide the opportunity to play, they really would like to empower the child. They want to make sure that the child doesn't feel weak and like they can't do anything because they're stuck in the hospital. They want to give that empowerment and keep it going. After the child life specialist lets the child cope, they provide emotional support. Emotional support is a big thing. When someone is in the hospital, you often have many emotions and you can't really talk about them because no one wants to talk around you. So, the child life specialist is there to promote emotional support for the parents, the siblings, for other family members, but most importantly, for the child. This gives them someone to talk to when they don't know who else to talk to. Child life specialists also have to encourage normal development for the affected child. When a child is in the hospital, they tend to miss lots of school. Therefore, the child life specialist needs to evaluate the development of the child, see whether they're at a normal level, whether they're above normal or below normal. After that, they need to create a plan on how to either increase the development, keep it the same, or even make it better than it already is. After they create a plan, they need to initiate that plan, use that plan, and track their progress to see whether or not they're getting better, getting worse, or staying the same. Last but not least, a child life specialist needs to be able to explain and provide information to the child and others. One thing they do, they need to explain procedures, outcomes, risks, etc., anything you would usually hear in a hospital. However, explaining a procedure to a child versus their family is a big difference. A mom might freak out when you're going to say that you're going to draw your child's blood, but they know that it's something normal. They know what's going to happen. However, the child life specialist needs to explain the procedure to the child in a way that won't make them scared and will make sure that they know what's going to happen while keeping them not afraid of the procedure so it can be done. They also need to explain this to others around them, the doctors, anything like that. This just lets them know what the procedure is, what possible outcomes are, or what outcome they want from the procedure, and then the risks associated with it. Last but not least, let's just review what a child life specialist is. A child life specialist is a really great thing for a hospital to have. They go through schooling to get their degree, then they use their degree to help promote effective coping, provide emotional support, encourage development, and provide information. Last but not least, I would like to ask you, how would a child life specialist help someone you know? Have you ever known a child that's in a hospital? Do you know a family with a child in the hospital? Does the hospital have a child life specialist? And if they don't, do you think that's something that could really help them?